The doctor said, "You're losing too much weight. This isn't good. We cannot wait till Friday. We have to move your surgery up." On our adventure.
Oh, you got freezing cold here.
Good Wednesday morning, everyone. It is day 2 here in the hospital. I've been on a slow rate of TPN all night, and I feel like myself almost. I'm not 100% there, but this is the best I've felt in a really long time. This TPN that was made specifically for me has helped so much. I could not believe the difference I felt in myself when I woke up this morning. I'm still not able to eat or drink much at all, but just the energy and fatigue and fogginess has gone. I was able to walk to the restroom. I still needed my walker, but there was no signs of me blacking out, and I'm so thankful that we started the TPN. TPN would probably be my next step if I couldn't tolerate tube feeding, but TPN doesn't hold up the integrity of GI tract structure and function, which is why we want to continue with the tube feeding. The doctor came in to see me today, and I'm actually feeling a little overwhelmed because originally my surgery for my J tube, which is a permanent feeding tube that goes to the jejunum, your small intestine, was scheduled for early Friday morning. Judd has Friday off, so he would be able to be here for my surgery, but the doctor evaluated me. He saw that I had lost more weight since being admitted yesterday, and he's just like, "I don't want to wait. We need to do this now." So he wants to get me in tomorrow when Judd has work. We don't know what time, and I'm stressed because we don't know if Judd will be able to be here because he just started this new job. He hasn't accumulated enough work hours to take time off yet. So, I mean, he's gonna talk to his supervisors, but we'll see, and I'm just feeling nervous about that. But I gotta wait and see how things play out. And I'm not gonna disregard what the doctor tells me to do. If he's concerned enough to move up my feeding tube surgery one day, then obviously it needs to be done. Getting my first breathing treatment done. I've done my morning breathing treatment. I have taken my morning pills. They've given me some medicines to help with my symptoms. And my admitting doctor, who's also my attending doctor here, came and saw me. He said he's a little concerned we're not doing the NJ first to make sure I tolerate the feeds, but he understands why we're going straight to the J tube, because why do 2 procedures if this is a permanent problem? And even at my best, like I said yesterday, I can only consume about 60% of what I need. So even at my best, I'll still get a lot of benefit out of the J tube because it'll give me the other 40%. Whatever I'm not eating, the J tube will make up for it. So it's a very versatile tool. Then the dietitian came in, and she actually gave me some information for an outpatient dietitian because I don't have one personally, but I need one. And she explained to me how to do the calculation. So right now I'm not eating any calories, and so I'm gonna rely completely on my tube feedings. But in the future, she expects that as I get nutrition from my Jaquie juice, or whatever I'm gonna call it, then I'll start to feel stronger, and maybe I'll get a little bit more of an appetite and I'll be able to eat. And as I eat more, the calories I eat, we just subtract that from the amount of Jaquie juice I get, which is the formula. The dietitian, the GI, and my attending doctor are all super on board with the J tube because it bypasses my stomach, which is the main problem area. And then after I get the surgery, I'll be here 3 extra days to make sure I tolerate the feeds and I don't have any issues with it. And then hopefully I get to go home on tube feeds and start to feel really great. The dietitian said she's really pleased that I'm feeling well on TPN. That's a great sign. It means my malnutrition is already reversing itself with the TPN. And when I get the tube feedings, it should take a few weeks, but I'll feel like myself again, maybe even better. Okay, so I'm going through excitement. Yes, I'm getting nutrition. Stress, excitement, stress. And right now I'm in a stress moment, and here's why. When the GI was here, he told me due to how frail I am and tiny and how much weight I've lost, the surgery may be a little bit more intricate. He may need to use special instruments and consult with certain people, and that makes me a little nervous, but I'm sure he knows what he's doing. He's a kind and intelligent GI. And then how they're gonna do the surgery is they're gonna do it like an endoscopy. I can't say these words. And so they put the scope down my esophagus to my stomach, and then when they get to the spot they want to be in, they shine a light and poke a hole there and put the J-tube through. And the hole might be in my stomach, the port where you get access, but the tube will end in my jejunum, or it may go straight through to my jejunum. It just depends what's easiest based on my anatomy when they get in there. Either way, it's a J-tube because it's going to my jejunum. So the surgery sounds simple enough, but the way he set it up, saying that because of how frail and tiny I am, it may be more intricate, that just made me a little uneasy, but I'll be brave. The other thing that left me uneasy is even though I'm feeling better on the TPN and we're doing everything we can for my malnourishment and weight loss right now, still the doctor said, you're losing too much weight, this isn't good, we cannot wait till Friday, we have to move your surgery up. That means things aren't going well, even though we're doing all we can, but we don't know what time the surgery is. I mean, I'm happy they're moving it up, I'm happy they're eager and like wanting to help me sooner, but I don't know if Judd can be there, so there's a lot that I don't know right now and it's freaking me out. I'm gonna try not to totally freak out until I know all the details because I'm gonna have faith and pray that everything works out. Okay, amazing news. My surgery is at 7 a.m. tomorrow, which means Judd can be there for it. His higher-ups are letting him do a noon to midnight shift tomorrow instead of his usual 10 a.m. to 10 p.m. But the poor guy is gonna be so sleep deprived because tonight he gets off at 10 p.m. and he's gotta be here by 5:30 a.m. in order to make it in time before they take me down to pre-op. And remember, this hospital is an hour away, so Judd has to leave by 4:30 a.m. so he has to be up around 4:15 in the morning after getting off work around 10:30 p.m. So he's going to be really sleep deprived, but he wants to be here for me, and I am so grateful for his dedication. Since he's making all these sacrifices, I'm letting him do what he's more comfortable with, and he's more comfortable leaving Harlow at home, and that's perfectly fine with me. Harlow's happy to stay home. I think it's just easier for him if he doesn't have to focus on Harlow. He just wants all his focus on me, on my surgery day, and that's fine with me. So I'm feeling so much more relieved now that I know the time and that Judd can be there. The anesthesiologist just came in, which is good because Anastasia and I don't really get along. When I had my port surgery, I was given a full dose of Versed, fentanyl, and Benadryl. If you don't know what that means, it means you should be knocked out. I was wide awake, and they used lidocaine, so I didn't feel anything pain-wise, but I felt a lot of tugging and whatnot, and it was weird. So I can't imagine I'd enjoy that in my intestines. But they're using a different type of anesthesia. She said people tolerate it well, which is good, because one time I've woken up screaming and hitting people and I don't remember it. Other times I just take a long time to wake up because of my narcolepsy, but I told her all the things that could possibly happen and she's got them written down, and hopefully all will be good. Starting to feel sick again. The dry heaving and puking has started, so just waiting on some medicine to help with that. All right, 45 minutes later, after some IV Zofran and Toradol and a little fluids, I'm feeling better. I also have my heating pad out. This is why I have the peripheral IV, because we can't stop the TPN or mix it with other medications like the Zofran and Toradol, but I'm wiped out from that, so I'm gonna take a little bit of a rest. I managed a few crackers and chicken broth, which is awesome, thanks to the Toradol and Zofran. I had an EKG, which was all good. I got the results of the chest x-ray back, those were all good. Don't know about the angiogram yet, but my doctor is sending my angiogram along with the ultrasound that looked into my median arcuate ligament syndrome to a mouth specialist somewhere out of state. And I'm just hoping to speak to the GI and surgeon one last time before my surgery tomorrow morning, because I'm getting a little antsy and I just have some last minute questions I want to be addressed. Well, I have had breathing treatments, medicines, another bag of TPN has been started. I did a shower wipe down again. I got ready for bed. I'm in my nighttime PJs. I will soon be signing the consent form for my surgery tomorrow, and the nurses were able to speak to my doctor about my concerns on my behalf, and I feel so much better now about the surgery. I was concerned because they are doing a scope down and then they're going to puncture a hole through my stomach, and the end of that tube will end in my jejunum. So it's a J tube, but instead of connecting it right to my jejunum, it's going from my stomach to my jejunum, and that's because it's a much less invasive surgery. They don't think I can physically handle the surgery to place a J tube straight to my jejunum. So they're going to puncture it from my stomach to my jejunum. It's less invasive, and so they think this is a much better option for me. I was just a little confused about it. I was worried my violent vomiting might dislodge the extension from my stomach to my jejunum, and they're like, don't worry about it, we got you. So feeling much better. Of course I have some pre-op worries, that's normal. I mean, I'm not riddled with fear, but there's just some things that are worrying to me. I mean, we can't be 100% sure that this is the right tube for me. We can't be 100% sure I'm gonna tolerate tube feeds, but this is the next step, and I trust my team. They have evaluated all the options and decided this is the best one, so we're gonna go with it. The other thing that worries me is anesthesia. Like I said, with my port surgery, I was awake, and I'm worried I'm gonna be awake for this one, or that it's gonna work too well and I won't wake up for a long time, or I don't know. Anesthesia always makes me a little nervous, but I'm not gonna worry about it too much because I can't control it, and I'm just gonna pray that things will go smoothly. Also worried about how this impacts Judd. I just got off the phone with him, and he's already made me feel so much better. He's in such good spirits and has such a great attitude about all of this, and I would love for him to be here with me. I would love Harlow to be here with me right now, but we have life that continues even though we're chronically ill and Judd has to go to work. We've got bills to pay, but I'm so thankful he's able to be with me here bright and early in the morning to see me through my surgery. He'll be here at 5:30, so maybe I'll be asleep, maybe I won't. I don't know how I'm gonna sleep tonight. Probably not great, but I get to see Judd, and that's gonna be amazing. I have a lot of people supporting me. I have y'all supporting me. Thank you for being with us. Thank you for walking this journey with us and coming along to see what it really means to live life with multiple chronic illnesses, and that just because somebody doesn't look sick doesn't mean they aren't sick. Spreading awareness for service dogs and invisible illnesses, chronic illnesses, all the different things. So thank you for doing that with us. I have officially signed the consent papers. They've taken my vitals. Soon they'll be in here to take away my drinks. I just have water to sip on because after midnight I am NPO, which is nothing by mouth, for the surgery, which, let's face it, I'm kind of NPO now anyways. The TPN is going to be continued while I'm still on it. This morning I woke up feeling pretty amazing, like myself, from the TPN, and then I crashed this afternoon after that vomiting spell, and right now I'm pretty exhausted and ready for some sleep, but who knows if sleep will come when you're waiting for a surgery tomorrow. But like I said, I'm not riddled with fear. I'm just ready to get it done and to start this new chapter in my chronic illness journey. Tomorrow we will keep you all as informed as possible. Times have been really hard lately with my GI issues, but tomorrow is my new day. And with that, Ellie and I want to thank y'all for joining us on our adventure, and good night.